Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, Digitalis toxicity or digoxin toxicity. Digoxin toxicity. So actually, Digitalis has a narrow therapeutic index. Because of it is a narrow therapeutic index drug, so the therapeutic levels of the digoxin are very narrow. So what are they? The therapeutic levels of digoxin is around 0.9 nanogram per ml is around 0.9 nanogram per ml, that is it is around 0.5 to 1.4 nanogram per ml. Then the toxic levels of digoxin is around 1.5 nanogram per ml, that is more than 2 nanogram per ml. So this is the toxic level. If there is more than 2 nanogram per ml, then it is toxic level. If it is 0.5 to 1.4 nanogram per ml is the therapeutic level. So these are the average levels. Now, whenever there is acute overdose, the overdose can be acute overdose of digitalis. When there is acute overdose of digitalis, then first and foremost we should give the patient digibind is given. What is this digibind? This digibind is an FAB fragment of IgG1 molecule. Okay. In the digoxin toxicity, potassium levels are already high. So we should not give potassium levels. Okay. You should not do cardioversion. Cardioversion is not done. Then hemodialysis also does not work for the digoxin. So the drug of choice for acute digoxin poisoning is digibind. Now, if there is chronic digoxin poisoning, this is in the chronic digoxin poisoning, this is when you can give the potassium. In fact, for chronic digoxin poisoning, the drug of choice for chronic digoxin poisoning is potassium.
thank you and thank you for watching.